just to explain who I am. So I'm Martin Epp. I'm based at the London School of Economics. I'm one of the members of the research team, the project we're going to hear about today. And I'm also, I have a couple of other roles. I'll come back to that in a moment. So firstly, just to say, so what we're doing today is hearing about project funded through the NIHR, National Institute for Health and Care Research, School for Social Care Research. And the project has been focusing on implementing NICE guidelines in social care. And what we're going to hear about today is a bit about how the project itself overall went. And then particularly, we're looking forward to hearing from some of the partners in the project, from local authorities, from NICE, and others who are going to be contributing to the discussion. So let me I think I will just do some logistics first. There is a relatively short presentations to keep you full of information. And then we'll have some wrap-up comments at the end. In terms of logistics, I mean, so the chat function, if you're not familiar with Zoom, you'll find it at the bottom of the screen. So hopefully, most people have been on Zoom a few times now, so hopefully that's going to be okay. And as I say, we've got slides from Annette's presentation. Annette will be speaking soon after I stop, and then other presenters won't have slides, but we'll hear about their experiences. So let me just introduce who we have got coming up in speaking. So I'll say something in a moment with my other hat on, not as the substitute chair. Annette Bauer is Assistant Professor and Research Fellow at the London School of Economics, and Annette's been leading the project and will talk us through that. Carol Paz and Julie Shepherd are from Northumberland County Council, and both have been very closely involved in the work and are very closely involved in their local authority in the implementation of NICE guidance in the social care field. Liza Turton and Rachel Scurfield are both based at Neath Port Talbot in Wales, and again been very closely involved in the project, and that's been one of the sites for the development of the project and the evaluation and the studying of what's been happening. Joe McCormack and Christine Cheney from NICE will be presenting. They both have a lot of engagement with the social care guidance world, and NICE have been important partners throughout the project. Then Ian McBeath, who is Strategic Director of Health and Wellbeing at Bradford Council, an ADAS Honorary Trustee, and has lots of ADAS history, shall we say, and involvement, is going to comment on the relevance of NICE guidance for local authorities. And then we'll also have a contribution from Margaret Ogden, who's been co-chairing the involvement group of people who have experience of using or providing unpaid care in the social care field. And if I've missed somebody in rushing through the programme, I personally apologise, but I think I probably haven't, so I think that's okay. All right. As I say, I'm going to just go on to say something quickly from my own perspective. So as I said, I'm part of the research team, but I've also been sort of playing a role. I'm director of the School for Social Care Research, which has been funding this project. And there's no conflict of interest in the way we fund these things. But just to say, the School for Social Care Research, at the end of this month, it'll be 15 years old. And it's been an important contributor to the research field in social care. There hasn't been as much investment in social care until relatively recently from public funded bodies, but NIHR, National Institute for Health, used to be called National Institute for Health Research. It then changed its name to have "and care" in the title. NIHR has been a really increasingly important supporter of research in this area. And as well as funding research like of the kind we're going to hear about in a moment, what the School for Social Care Research has done is funded capacity building to help people to develop their research skills, or people working in practice roles to get engaged with research. And we were delighted that Julie and Liza and Rachel all had funding through the capacity building part of the School for Social Care Research. And I think, well, from my perspective, you can see how that's hugely contributed to this project as well. And I hope it's going to be helpful to them and to the social care world going forward. So lots of reasons why I'm very interested to hear what we have to hear today. So I think, Annette, I'm happy to go over to you.
Yeah, thanks, Martin. I'm the only one actually kind of having slides here, and I'm going to kind of quickly go through those. So on the Value and Care Guidance Study, you should have received a summary report as well. There you can read more details about the findings, but if not, please do email me. Just need to kind of navigate to the next slide. So first, why did we do the study and who was involved? So obviously many reasons, but the main one is that we really heard from people in the field that guidance is not implemented much in social care, and where it is implemented, we just don't know how it's kind of done. So the aim of the study was to explore the processes by which guidance is implemented and get a better understanding of resources required and the value generated. And just to add here, what we mean by implementation is really all efforts done by people employed by the council who led the implementation and who work on getting other people in the council and service providers to focus on guidance implementation and provide support in helping them to do so. And you will hear from some of them today. So that includes people like Julie Shefford, Carol Pass, Rachel Schofield, and Lisa Turton. There are also many others, including Carol Pearson, Andrew Arrington, Kay Drury, and many more. So before we move on, I just wanted to acknowledge the support from NIHR, SSCR, as Martin highlighted, which funded the study, and also the Applied Research Collaboration with STEM, which adopted the study, as well as from the support from the study team, which included excellent and some world-leading researchers from the fields of implementation science, economics, and health and social care policy. And obviously the wonderful support from the advisory group and the involvement group. And some of you are here today, and you have been really instrumental in making this study happen. So just really grateful for all of that. Quickly, an overview of the study. So we had the 3 local authority sites who were involved throughout the study. And on the right-hand side, you can see some characteristics. So Nice-Port Talbot is much smaller than the other sites, has the higher level of deprivation and people with social care needs. Whilst Northumberland and Coventry are much more similar in size. Coventry has a kind of like highest, or the kind of like much younger population compared to the other side. And the approach we employed is a case study approach where we collected information from managers in councils and from service providers. So the study is really hypothesis generating. So it's exploratory rather than confirming. That's important to bear in mind. However, we have employed a robust process of collecting data through various data methods. We have confidence in our findings. And I'm going to try and refer to some of this as we talk through the findings as well. So you can see some of the guidance topics here that we looked at in particular, just because this is where we could get most information on. The guidance had been kind of like implemented in the site, or most kind of the work had happened since 2019, although some work had kind of like started before then as well. So first, how is guidance implemented and what are the costs? And why is that important to understand? So we wanted to understand the size of the efforts made to implement guidance, because we know from other fields at least that it does not just happen. So guidance is not just kind of like on a website and then kind of like taken up. There's a lot of kind of like evidence also of implementation failure. So understanding all the activities is it's almost like a first step to understand then what's potentially more important to do, what's less important to do, to kind of really do implementation well. So we collected data on activities using templates. They're called activity diaries, and we coded them based on categories from the literature, but also as they emerged from the data. And so this was a really highly iterative process and lengthy process. We assigned then cost to the time spent by those individuals. And what we found is that there is substantial variation between not only the sites, but also the guideline topics, but also some common activities, which I'm going to show you on the next slide. But we found overall that the efforts that were kind of done really reflected the very challenging situations in which local authorities are. And we also found that what was really driving the cost is the nature of the process rather than the type of activity. So it was really much more about the fact that some activities were done in participatory ways. We also found that council applied a mix of strategies. So some, like started in one service area with one guidance topic, and then developed almost like a prototype for implementing guidance that could be then kind of like rolled out within the wider organization. And also like using existing governance structures, such as kind of like policies or training programs. And another strategy was to kind of like empower and build the capacity of frontline staff to pick up guidance. On the next slide, it's quite busy. I'm just kind of like quickly showing you the distinct efforts being made throughout by the councils and the service providers to implement guidance, from setting up structures and changing senior managers' awareness and knowledge to prioritizing guidance and recommendation. And then for those priority areas, so then kind of like plan, conduct, and review a wide range of activities. So mainly those with service providers, such as training, auditing, case mapping. We will hear from the speakers surely about some of those activities in more detail. Some of them are done in quite innovative ways. And then finally, efforts to kind of like share the success of that work, but that was done mainly narratively rather than through data. And you can see the costs are really reflecting those efforts. So here the costs are the ones per year. It's important to emphasize they are not expenditure costs, they're for staff time. But you can see that most costs occur maybe as expected for the actual implementation with service provider. So what you can see under kind of like B2, but the cost of building in infrastructure, so that's under A, and for prioritizing guidance, which is B1, is also actually causing quite substantial costs. And then the next thing is like, so what about the outcomes linked to guidance implementation? So what we wanted to understand first is how implementation is actually expected to lead to outcomes. So what is the logical pathway here? And this is important for strategic planning, but also for designing an evaluation framework for future research. And we conducted workshops with council managers, and we used other information to then kind of like map out those pathways. And I'm going to show you that on the next slide. So again, we heard different stories from the side, but there was a common path from changing staff awareness, competence and well-being, and better relationships with partners, to achieving a shift over time towards maybe more prevention-focused service that would then allow more people to live independently in the community. And then, as you can see from this slide, in order for those kind of like longer term outcomes to happen or to be realized, a number of changes need to happen in that everyone needs to kind of like buy into that vision and really have the right knowledge and skills to support it. Senior managers need to be able to ensure the organization infrastructure is available to support it. This includes having implementation leads, which who in turn have to have the right skills and knowledge to engage with service providers and do it effectively. And then an important part is, in order to kind of like almost keep that kind of virtuous cycle or closing the virtuous cycle, is that kind of like sharing of success, so that over time, like there's more kind of like learning about guidance successes or implementation successes shared, and therefore kind of like increasing even more buy-in and creating more of an infrastructure over time. And also highlighted the important role of service users and carers. Potentially, there wasn't actually as much knowledge about their role, but at least the potential role and how to kind of like almost achieve a demand-driven uptake of guidance. Next, what outcomes we actually find in practice, and this is really hard to measure, as you can imagine. Impact takes a long time, so we were trying to really look at things like knowledge, changes in knowledge, or attitudes or skills in service providers, but also like the evidence of changes in practice. And we did that by doing kind of like surveys with service providers. And this is important, obviously, just for the purpose of the study. That's what we were interested in, but also just really to kind of think about in the future, what can we actually measure like realistically, and in a, like, and how can we measure it in different kind of like time frames. So based on the surveys of service providers, we then did find some changes in knowledge and awareness, mainly about the contents of the guidance, rather than necessarily the skills how to change practice. That's more complicated. And we also found that there's overall potentially a high adherence to good practice as outlined in the guidance, but it also showed that there are areas that are still missing. And for the full implementation, that would actually really require additional resources and sometimes system changes, and especially resources from at the kind of like service provider level. So we did assess based on service provider accounts who mainly kind of drew some information from case records. We did assess that good practice is likely to achieve substantial economic benefits. So we identified, for example, for this one site, 4.6 million, and that was related to kind of like reduction in care home admissions and A&E admissions, and also reduction in kind of like in the crisis and legal services. So that was kind of like a more kind of hypothetical value, but it kind of highlighted that guidance has the potential to contribute at least to kind of like important prevention outcomes, and that kind of like envisaged resource shift as hypothesized by the council managers. And then finally coming here to an end, and hopefully this will be kind of like, what we're also discussing a bit today. There are obviously recommendations for what we can kind of like do better, what are the next steps. So some areas is that because there's so many guidance and so many recommendations, we do need better knowledge of how to prioritize them for local authorities, and we also have really much more clearer links about the inspection procedures. And I'm sure this will be discussed today a little bit more. We also need well-to-knowledge exchange about implementation, like what effective implementation actually look like. We had a show and tell series as part of this study, which worked really well with the sites, but we need that as a kind of like larger scale, and inviting more people, not just necessarily local authorities, but maybe also implementation specialists and researchers and service user and care representatives. We learned about the importance of having governance structures at local authority level, and one way maybe to address that is having implementation leads at the different organization levels, but then those also really need to be supported and equipped to implement guidance in a good way, in an effective way. And overall, that really means we need more intelligence to understand implementation approaches, like what works best in what context. That requires really a much, this was a collaborative effort, but an even collaborative effort involving more of those people outlined here at an earlier stage. And then I just added that slide because I like it so much, and it just kind of like shows a very nice kind of capacity building exercise that was done in Northumberland, and really highlighting the value of co-production.
Okay, thank you very much, Annette. So I think what we're going to hear from now is hear from Carol and Julie from Northumberland. We're going to talk about insights into implementation of the guidance, some of the challenges, and what they've learned about what works in their context. So can I hand over to Carol and Julie, the dynamic duo. So over to you.
Thank you, Martin. I think I'm going to start. As I'm Carol Paz. I'm responsible for quality assurance activity in Northumberland County Council Adult Services. With regards to NICE, a lot of my work's been focused on setting up the quality assurance governance structures, which help create the conditions for NICE implementation and for the prioritisation of guidance topics. For example, over the last year, we've been co-producing with our staff our quality of practice framework, that includes NICE guidelines as a key driver for change. We've also produced some NICE implementation guidelines for our staff, so everyone's clear about our approach to NICE implementation, and we had support from Craig Davidson in NICE to make sure that they were appropriate and effective. We've also got a nice little 7-minute briefing for our staff as well. We've got a nice webinar on our training platform, and we also do team building exercises. For example, I've just done a talk with the hospital discharge team about our NICE guidelines, and specifically signposted them to social work scenarios on the NICE website on discharging people from hospital. So real practical operational support for some of our teams. We've got a monthly quality and governance meeting, which includes NICE as a standard agenda item, and we talk about new and revised NICE guidelines, and any changes, if it's applicable to us, who would lead on it, which services need to be involved. For example, we've just talked about the new quality standard 140 for transitions, the revised updated one, and noted there's a new recommendation in there, and we've talked about it talks about having a coordinated plan for children who move from children to adult services, and we're just talking about what that means for us and how we can implement that. We hold monthly half-day quality workshops with all our heads of service, senior managers and team managers to discuss all aspects of quality, and that includes findings from NICE baseline assessments and subsequent service improvement work. I think in relation to NICE, we've had a long history of NICE in Northumberland. We were part of the acute trust, our social care teams, and I think being part of health has really demonstrated to us the importance of NICE, and then we've continued with that once we came back into the local authority. See the value of implementation, both positive outcomes for the people who use our services following any service improvements, but also financially in the knowledge that we're following evidence-based best practice. We kind of feel like the work's been done very nice for us in terms of piloting areas of work, ensuring we're statutory compliant, demonstrating positive impact. So it improves the confidence in our services if we follow in the guidelines. A recent example, our OT service also completed NG86, which is around people's experience of adult social care services, and identified that they needed to improve mechanisms for gathering client feedback. And it's since developed a number of initiatives, such as a feedback survey for all clients at the point of case closure. I have to admit, when I saw the results of the work done by this study, I was surprised initially at the cost associated with implementing NICE, but then we reflected on it locally, and yes, that includes all of those pre-implementation costs, all those structures and things that we have in place, as well as the operational delivery as well, which I guess once we reflected on that, we could understand those costs. But actually we feel that it would cost us more if we didn't use NICE as a guide, because then we'd have to do our own research around the best practice, and all of that work's done for us. So we feel it is a cost-effective way of service improvement. As a quality assurance lead, I feel that following NICE is really helpful. Often adult social care and measuring impact's really hard. It's a subjective area and difficult to quantify, and I think NICE guidelines really help us to demonstrate progress. And really it's a systematic way for us to undertake service improvement as well. So we feel that it's an excellent resource, and we'll continue to use it as well. And Julie's going to talk about more from an operational perspective and her work on implementing NG86.
Thank you, Carol. Yes, my name's Julie, and I'm the service manager at Northumberland County Council, and I manage Shared Lives Northumberland, which you can see behind me. But I also have responsibility for the not the implementation, but making sure that staff in our in-house services are aware of guidance. So our in-house services are day centres, residential care, and some independent supported living, as well as my own service, which is a very similar service to fostering, but it's for adults with an assessed need. So as Carol said, we had a lot of sort of experience with NICE and guidance and how to implement it as managers, because we were part of the NHS. So, you know, we would have monthly meetings, and I think that lasted for the last 5 years. So when it came to do this study, it was a really useful sort of exercise for us, because for myself, you know, it offered me some time to, you know, during the pre-implementation stage, to carry out some surveys with all of our frontline staff, as well as our carers who are part of Shared Lives. And I was quite surprised and shocked that 70% of people hadn't heard of NICE, particularly how it related to social care. You know, so it made me think, what have we been doing as managers for the last 5+ years, you know, saying that we were compliant and had it implemented, you know, so it was a useful sort of exercise. So the awareness session sort of broke down what's in NG86, and I was really pleased that we had this guidance to work on, because it's all about people's experience, how we work with people. It's about co-production. So for me, it was something quite exciting that could become quite real to people, you know, to see how we can improve services. You know, so I held numerous awareness sessions, and what was interesting was that without even knowing what the recommendations were, people were saying, oh, we do that anyway, you know, that's what we do, we work in that way, we involve people and we listen to people, you know. So it was sort of a good start, and it was sort of I think people were sort of really interested to say, oh, it relates to our role and it relates to what we do, you know. So it was really sort of quite good to staff, because I hadn't really thought about it prior. Following on from the awareness sessions, I organised some co-production events around NG86 with a focus on co-production. And as Martin said, I had got an award through the Building Capacity sort of award. And I used that to sort of get some experience around research methods, you know. And you would have seen on one of the next slides a picture of some of the participants, and they were sort of my carers, you know. And we followed I followed a participatory research method, which was sort of like very interactive. Obviously, it was a long day. People really enjoyed it, got a lot from it. And what was sort of like really sort of heartwarming and sort of like good for me was that people went away straight away and held events in the day centres, in some of the residential homes, in the ISLs, looking at ways that they could work with people, and they involved the people who use their services. So I got all of the pictures from them and sort of like thank yous, you know, it was really good, I enjoyed that. And people have come up with different ways of how to improve the services. So for me, that's what it was all about. I'm trying to keep to my script because I know we're time pressured. So because 70% had said that they weren't aware of NICE, but the vast majority, as I'd said that they followed this guidance. One of the challenges for us was that a lot of the staff and carers thought it was the manager's role to implement guidance and to make them aware. So clearly that hadn't worked in the past, you know, so following on the project, we changed that and we got like frontline staff, care assistants and some of our carers to look at the guidance and look at what's relevant and implement that in their services. So that's like a work in progress. I can't say that it's fully sort of like committed, but it's something that we've started. Let's have a look. And I think the learning from myself is that, you know, it doesn't sort of work that managers implement the guidance, because I think staff just sort of like switch off and think it's somebody else's responsibility. I would say don't get hung up on the baseline assessments, because you open them and you look at them and you think, oh my God, there's 198 recommendations. Where do we start? You know, I think we in Northumberland, we saw it as a development opportunity, you know, for services to look at. And I think what was interesting, carers were saying, oh, well, I've heard of NICE within health, because I hear when I go to my doctors will tell me about treatments and treatment plans, but you don't hear much about it for social care. So I think really NICE could do a lot more work on sort of like implementing a campaign to say, for instance, in care homes and, you know, people in the community, what guidance there is that's important. And I think basically that's what I have. That's all my findings.
Wonderful, thank you. That's great. Carol, did you want to come in at that point, or that's? I love the way you finished, Julie. That's what I have. That's great. That's good. All right. So, any comments or questions? We're doing perfectly for time. Actually, we're on time. Got time.
Can I ask a quick question, Martin? Yeah. I'm sorry, yes. I cannot see the hand option. I just wondered about some of the smaller guidance that come out. For instance, I was a lay member on a QS with NICE on oral hygiene in care homes. So it was more on the health side, but it was in the social care setting. And I just wondered, do you keep an eye for those smaller documents that come out, and are they particularly challenging?
Yeah, like for me, we sort of like look at all of the guidance that's relevant, you know, and then decide what services it sorts of suits. And I know we recently been having some guidance on one of the QS ones around oral health care, you know, so we'll sort of like look at the guidance and see what we're already doing and what's not in place. So that's my perspective. I don't know if Carol wants to add.
Yeah, well, any new guidance or revised guidance, we talk about it in our monthly quality and governance meeting, just to say, is this applicable to social care? Are there any elements of it applicable to social care? We'll have a discussion there and then decide on which service it would need to go to. So in particular, if our occupational health services, therapy services, they cover a lot of documents that are wider than social care. So we do look at a lot of the ones that aren't focused on social care as well.
So another example would be the quality standard on falls prevention.
Yeah.
That's another one, isn't it? Yeah, thank you.
Yeah.
Great. Actually, Maria, do you want to ask your question? If you can unmute, I think you probably...
Yeah, I think I've managed to find the unmute button. Thank you. Yeah, I'm just absolutely fascinated. Yeah, I obviously was very familiar with the health NICE guidance. I've sort of lost touch over recent years, and I was wondering, how would we find out when new guidance is issued? How is it disseminated, publicised? Is there some sort of mailing list or something to alert us when a new piece of adult social care guidance is issued?
Joe, come in because you put something into the chat. Go on.
I did, thank you, Martin, and great question. So on the NICE website, you can browse all the guidance, and when you click that button, it gives you an option on the left-hand side that you can scroll down for specific social care guidance. There's 71 of those in the collection, and I've directly put the link to that section in the chat in case people want to see the example of that. And it pulls up all the guidance, and you can sort of work your way through. So historically, we did label our guidance as clinical guidelines, social care guidelines, public health guidelines. And when they had big overhauls, we tended to then move away and just call them NICE guidelines. So you'll see some of them have changed over time, and they may have that generic title of a NICE guideline, but be relevant. And the relevance is because a lot more of what we've published is across the whole journey between health and social care. So it's a lot more integrated. So it may change and be superseded with a NICE guideline number, but I've put the link directly to the ones that are still called social care guidelines that are in there. I hope that helps. On the point of how people are notified, you can just look either on a periodic basis at the NICE website and just see what have we published in the last month. Alternatively, on the website, you can sign up for the newsletter, and it's a health and social care newsletter now. It's on the homepage at the very bottom. I can put the link or a QR code. I'll try and put that into the chat. That will maybe help people, and you can sign up directly for that, and that will be the consultations that are coming out, anything new that we've just published, sometimes a news or blog article, and very keen to share stories like what today's managed to cover and discussion points. Very keen on that, and so the details perhaps from this trial will be shared in there. Some of the findings, we can link to those.
Thanks enormously, Joe. And there are two very helpful people on the call, Judith Richardson and Craig Davidson, who put some links into the chat as well. So lots and lots of information there. We've got Jonathan. Do you want to quickly say what you put into the chat and anything further?
Yeah, just wanted to say really well done, because I mean, I was on the guideline committee developing NG86. It's such a wide-ranging guideline. It covers everything, every setting, every type of support need that people have. It was quite challenging to develop it, but really pleased to hear how, you know, you've actually made it work practically, and you've actually engaged your staff with implementing it. It's not easy to do, and I really agreed with your point that actually for social care staff, everyone knows about CQC, everyone knows about DHSC, but not that many people have got NICE in their heads, and maybe there is more that could be done there, and I wonder how we could build that awareness, because there's some really useful advice in those guidelines about how to make sure you're doing things in a best practice sort of way. So, but really glad to hear NG86 has been good for you.
Thank you very much, Jonathan. Okay, any more points people want to make? We've got a couple of minutes. We're doing well on time. Well, 1 minute. Anybody want to come in? If not, okay, we'll go on to Liza and Rachel. They're going to talk us through what they've been doing in Neath Port Talbot. So over to you, please.
Hi, I'm Lisa Turton. I'm a consultant social worker. Rachel and I started working with NICE back in 2019. Rachel applied NICE guidelines to individual cases, where I applied NICE guidelines to policy writing on a regional basis for West Glamorgan and Safeguarding Board. We've done a little bit different to Northumberland in that we haven't applied a NICE guidance in its entirety, mainly because there was no NICE guidance on self-neglect, which was quite surprising for us. NICE did signpost us to Sky guidance, self-neglect and safeguarding, but we really wanted to look at preventative social work as well as our safeguarding arena. But what I did know is that we need to get better at our mental capacity assessments, and mental capacity's role when it comes to somebody who has self-neglecting behaviour. So we applied the NG 108 within our regional policy. And part of that was having a launch day then on a multi-agency basis, so very much looking at self-neglect, but also the tools within that policy document that practitioners could call upon in their practice. Feedback from our staff has included the confidence that NICE guidance can give them in terms of when we're looking at a multi-agency arena, how it sets the scene really for different roles. And I think sometimes that's where we've had difficulties working on a multi-agency basis, is people not sometimes being quite clear on what their role is. So that's helped us. And in terms of costs as well, I know Northumberland was mentioned about the costs, and we had a surprise from our costs too. But we've reflected on our costs, and I think very much we don't have anybody specific working on implementing NICE guidance. It's very much pulling on NICE guidance as we're doing our work. And I think that then in terms of our costings, when we pull people on a regional basis, it's very much, the costings very much around people sitting around the table really, and that's where our costings are coming from. But I think we're inspired by Northumberland. Northumberland have been very helpful to us when we're looking at our transition planning in Neath Talbot. And I think this time around we're going to look, well, actually, do we look at NICE as an entirety when it comes to the guidelines, as opposed to making NICE fit our policy? And that's something we're going to be looking at. And from this work, Rachel and I developed an e-learning for practitioners. We're both qualified social workers. And our feedback from practitioners were that although they were reading guidance, they were reading research, they find it very difficult to implement that into their assessments or the case analysis, that type of thing. So we decided, well, Rachel done our e-learning for staff to be able to implement how they incorporate NICE guidance into their practice. And I think Rachel's going to tell us a little bit about a learning event that Rachel held when it came to applying NICE guidance retrospectively.
Thank you. Yeah, so like Lisa said, I looked at cases that I had on my caseload and using NICE guidance. And then what I provided staff with was, when I was doing my work, I would look at the key aspects within that person's situation and pull out the NICE guidance that was relevant to that person, and then sort of skill myself up with that knowledge that would then guide me through all aspects of that person's journey. And then the learning that I gained from that went into the e-learning package. But also within one case, I was able to demonstrate that by tooling myself up in the beginning for this person, using NICE, I worked throughout her whole pregnancy and delivery, and then an unfortunate incident occurred and we had to go to our safeguarding board. And I led a multi-agency learning event around that situation, and NICE was at the core of that, and we were able to use all partners around the table: health, local authority, voluntary sector, another local authority for fostering. We worked together on how this situation had occurred, and also pulled out the learning from NICE that could have guided that practice. And NICE attended that as well with us. Chris Coleman attended to support us in our learning. So it was a really beneficial event, and it showed that by investing in the beginning of casework in social care, you can then save time and be more effective as a practitioner going all the way through.
And this has inspired Rachel and I with our champion research project. So very much that we hold case mapping sessions now with staff, and we use NICE guidance as our starting point. We really feel it sets the scene for practitioners, especially from a multi-agency response to the people we support. It's been very helpful for our social workers. We always like to quote one of our favourite social workers saying, "I'm going to rock this meeting now. I feel like I know what the guidelines are. I feel like she was able to challenge other professionals, but also understand a lot more around her own role and responsibilities as well." Thank you.
Hey, thank you very much indeed, Lisa. Pronounced your name incorrectly earlier, sorry, and Rachel, thank you very much for that. I've got a couple of things to say. One is, I mean, three things to say. I would say, firstly, I'm going to embarrass Lisa and Rachel when saying this. When we were interviewing for the Capacity Building Awards, they applied for the Practice-Based Leaders Award for their authority, and the awards were only open to English local authorities. But they'd applied they snuck in from Wales, and we had a director, a very experienced director of adult services on the panel, who said they're so good that A, I want them to get this award, and B, I'm going to try and recruit them into my local authority. So, so just to make you blush a bit, but I think I think that blend of both the research involvement and the capacity building award has been really helpful. And I know that you had the event in Neathport, in South Wales just before Easter, to talk about some of what you've been doing. So I think that's also very good. So thank you for that. The other thing to say is that, and I think Margaret picked this up in the chat, the cross-learning across projects like this, it is helpful for local authorities in this context to be able to compare experiences. They get probably much more from each other than they do from the research team, and that's been really important in this case. And we had, as Margaret mentioned in the chat a bit earlier, we had these sort of monthly show and tell events where people come and talk. I know Jonathan talked about what happened in Harrow, for example, and we had commentary in Northumberland and Neathport Talbot all presenting, and others. So again, it's about sharing that experience. It's quite difficult to read about that, but having those short sessions to do that's been really good. So I think what we could do now is go to Jo and Christina to talk about the perspective from NICE. You ready for taking us forward, please?
Thank you, Martin. It's great for Jo and I to be here for NICE. I'll introduce myself. My name's Christina Cheney. I'm fairly new to NICE. I've taken up a new role that NICE have developed of social care advisor within the organisation. So that role is primarily to be a voice for the sector within the organisation of NICE, and kind of again, a lot of you have talked about the visibility of NICE to social care. So there is an element of that role as well about trying to promote NICE and the use of NICE guidance more widely to the sector alongside our implementation teams, which Jo works for. So Jo, do you want to introduce yourself?
Yeah, that's great. Thanks, Christina. Jo McCormack. I happen to be a nurse by background, but I've worked at NICE for the last 6 years. I'm currently an implementation consultant, so I support the implementation of our guidance and our products with organisations and networks and alliances, predominantly in one region of the country, but there's a handful of me at NICE, and we have coverage across the UK and Northern Ireland. So I predominantly support the Midlands and the East of England, but it is about that support across health, public health and social care, and with the implementation of evidence-based practice.
That's great. Thanks, Jo. And it's really great for us to be here. And there are other colleagues from NICE on the call as well, who I know will be finding this really useful information. I think the findings of this study and the study itself and the work that these local authorities have been doing to implement NICE guidelines comes at a really opportune moment for the transformation and development work that's going on within NICE as an organisation. As an organisation, NICE, I hope some of you will be aware, there have been a number of public consultations that have been live, and some of them are still live for people to contribute to try and support the transformation of the organisation. There is a particular focus on being very clear around NICE's role in social care. We've published some strategic principles in relation to how we will meet our mandate on social care, and we've talked also and developed a new prioritisation framework for how we will prioritise new guidance and updates to guidance going forward, so that the organisation can make sure that they're meeting the needs of the sector, they're prioritising the topics that matter most to people and to services. So hearing the information from the study today, I think, is something that we can take back into the organisation and really put to good use in thinking about how we can maximise the impact of NICE guidance, how we can listen to the findings of this study. So, I've been making some notes from what people have been talking about and reading the report that came out prior to this. And there's some really useful learning points, I think, for NICE to take forward from that. Particularly in the report, there was a comment around the kind of the amount of of guidance, the complexity of guidance, and some people have talked about that, looking at some of those benchmarking tools being, you know, long and complex. And again, I think that's something that's been looked at, and there is a real consideration about how can we make products from NICE that are really useful and usable to people to be able to implement. And someone did reference earlier on some of the quick guides that have been used in social care. I think it was Margaret, maybe you talked a bit about the guide in relation to oral health in care homes. And so there are quick guides that have been designed to be more helpful and easier to access. So again, looking at that going forward is something that the organisation will do. And there's also been some comment around the links to regulation and the links to CQC inspection. NICE guidelines were mapped previously to the old inspection framework, but we have a new inspection framework for local authorities and providers and ICBs, and that's something that we can look at going forward about how we can make our guidance and review our guidance and its relevance to those to support local authorities in being able to prepare, because it's that quality assurance activity that NICE guidance can really support with. And hearing from Carol, particularly around the quality assurance work that she's done in Northumberland, and the way that that's been mapped and the way that it carries on to keep relevant, I think is again something really useful that we can take back to think about how we can support other regions to do that kind of work. It's really helpful again to hear about, I really liked what you were saying there, Julie, about it being an all staff ownership in terms of implementing guidance, and then that's something that everybody's got to do, and there's quite a lot of comment being had around how the use of NICE guidelines can improve confidence for staff. I'm a social worker myself, and social worker as a profession very much takes responsibility for taking on really difficult decisions, practicing in the real kind of complexity of human experiences, real grey areas, and that's a real difficult responsibility for staff to take on. So having guidance from NICE that's evidence-based, that's got that status, can really support staff to feel confident. That can help with staff morale, and again, staff morale and workforce well-being is a key priority for the sector. So I'm really pleased to hear those findings, and I think that's something that we'll look to take back to the organisation as well. I noticed as well some of the enablers that you identified around implementation support being a big enabler. So having colleagues like Joe available from NICE is really important to kind of shout about that. There are implementation colleagues all across the region that can support systems and services who are looking to do this work to try and help that. And again, NICE as an organisation, as part of the transformation that we're doing, are really keen to focus a lot on what's the impact and how do we implement. And we've got really great skills at producing and reviewing evidence and producing guidelines, but what we need to do is make sure that that's usable and it's useful and it's being implemented. So I don't know, Joe, if you want to come in any more about how people can access that implementation support from your team.
Yeah, great. Thanks, Christina. And I'd echo all of what you've just said there. You know, this has been a really important exploratory study, and it's about that importance of the research, isn't it? Closing the loop and actually sending that in, and NICE being aware of it, because when NICE publishes, it's publishing on the evidence, isn't it? So there's that real importance that research plays in us being able to create these things for the system of what's useful and usable. I've put a link into the chat just on the quick guides. There's a collection there. It's the work that we did with Sky, very visual, and it's all downloadable from the NICE website. So the link I have put in there. For me, just before I mention a little bit more about how we could support from an expert sort of in the field there, what I found in terms of the findings that really struck home for me was the mention that study had given staff confidence, and it had reduced stress as working in a complex environment where making decisions is difficult, that NICE can help. And that really struck home with me. I thought that was really important. So my role out and about in the field is that implementation support, and some of that actually is sharing that best practice from around the region and being able to tell these sort of good news stories or these shared learning examples. So I do have a role in terms of informing about NICE and implementation support with activities, quality improvement activities there, encouraging that sort of partnership working, being able to signpost, being able to connect across the system as well. So yes, very much looking forward to future work in the area and capitalising on all the enthusiasm and the interest in the work that's been done.
All right. thanks very much to Christina and Joe. That was great. And we got a question. I may not pronounce your name correctly. Hitan Dodia. Do you want to voice your question?
Yeah. So I'm a public health consultant in Lambeth, and I've been involved in the NICE public health advisory committees for quite a long time. So I was just wondering. I mean, I'm not anymore, but I mean, I was just wondering to what extent there is a research gap in developing NICE social care guidelines, because I know there is a gap in public health guidelines for sure. What is the quality of the research evidence? And I know, again, from public health, I know that some of the evidence is weaker quality in a sense. And how timely are social care guidelines in terms of supporting social care workers in the front line?
I'm happy I'm happy to come in a little bit on those if I can, Hitan. It's I think they're all really great questions and observations about the nature of the landscape in which we're practicing at the moment. I think social care research hasn't been an area of as much activity historically, but I think that's building and has been building over recent years, and we're seeing a lot more funding coming through. And as Martin and Annette can testify, there's a lot more funding coming through in the School for Social Care Research to be able to produce more evidence base within social care, and there's a real appetite for building greater evidence in social care in the same way that we've seen in health over the years. And I think NICE have got a real role to play in being able to close that circle. If we're starting to receive more funding and to start to have more evidence being generated, more research activity going on, then when that evidence is generated, we want to be able to find ways that that evidence can become guidance for staff to be able to implement in services, because that's the reason that we're trying to generate it. What it does mean, social care research and social care evidence and the nature of the methodologies that we might use mean that the evidence that's generated might be different to some of the healthcare types of evidence that might be easier to develop guidance from. And so we do need to look at and be able to recognise how we capture and manage and review that evidence so that we can produce things that are helpful for the sector. So I think that's some work for the organisation and all guidance producing organisations to think about and consider, to make sure as this evidence comes through that we can find ways to robustly evaluate it and make it useful. In terms of timeliness, again, that's something that's been discussed and reviewed in relation to the consultation work and the new prioritisation framework within NICE, in how we make sure that guidance is produced in a timely way. And there are a number of different methods being tested within the organisation to bring evidence to the sector as quickly as possible in some other areas outside of social care, and that's something that we could look at particularly. But the new prioritisation framework is how all guidance will be prioritised, and updates to guidance will be prioritised through this single framework, which will be transparent so people can see what's being prioritised and why.
And the only thing I was going to flag on that is when the committees want to make a recommendation, but the evidence really isn't there, they'll often make recommendations for research. They're a great port of call to say, what is the evidence gap there? And there's a number of those that go forward from NICE each year to the NIHR in order for a funding call with that to try and address that particular gap. But if there's an area of interest, it's really worth going to the guideline associated with that and just clicking on just below the recommendations. It says recommendations for research. It's really useful to look there. Sometimes some of what we say, we use the wording to try and show that actually the evidence perhaps isn't as strong as what we would want it to be. So sometimes it's expert opinion, sometimes it's consensus that comes from then that process that we follow in order to be able to say something on it.
Lisa, do you want to come in with that? Lisa Dibsdale, do you want to come in with your question or comment?
Yeah, my name is Lisa. Obviously, I'm a researcher on the Connected project. So we're working with the local authorities on building the use of research in social care down in the southwest. And it's been really interesting hearing from people, because when people give us topics from the local authorities and we look for research for them, and sharing NICE guidelines has been part of that. And it's been interesting to hear, as others said, of staff that didn't know about those guidelines and hadn't read them, so we were able to share. But one of the things that came out for us, and I wondered whether NICE thought about it, is that as many of the some of the guidelines have kind of training recommendations for staff, which have been helpful for us in terms of, you know, what does it kind of recommend for training. We were looking at kind of debriefing and mental health of staff, and it had some recommendations, and I wondered whether I'm an occupational therapist by background, so clearly I know that a lot of the NICE guidelines, not just the social care ones, are relevant. But I wondered whether with the social care NICE guidelines, whether there'd ever been a thought to kind of pull all those training recommendations together, because it's quite difficult to pick out of the different guidelines different training recommendations, and I think it could be a real resource for social care in terms of, you know, actually the guidelines say this, and in terms of training, because I think I work with an evidence champion who works for the local authority I'm working with, and she sits within learning and development, and she said, I'm trying to pick this out, surely someone's done this, and so I just, you know, and so it was just a thought, because that would be, if it could be done, that'd be really helpful for us. So yeah, that's really interesting.
That's definitely something that we can take back to NICE. It's always open to any suggestions from the system of what people would find useful. So that's definitely something we can take back. But I just wanted to highlight that on a guideline landing page for the topics, you have a ribbon across the middle. And the second option in after the actual guidance talks about tools and resources. And what we try and put there is anything that the system has found useful to support implementation. You will find the baseline assessment template there. You will find a resource impact assessment there. What we sometimes put there is any educational resources that people have found useful, shared learning examples where they've given us a case study and somebody said these were the pitfalls, this is how I overcame them. An algorithm for sepsis that made it easier to implement that guideline. Anything like that, we've tried to collate separately on that tools and resources page, so it's always worth looking there.
That's great. Thanks very much.
Brilliant. Thank you so much. And just to say, I mean, Julie, do you want to come in? I'm going to pick up something else.
Yeah, I just really wanted to say that within Northumberland, we've worked sort of like very closely with our NICE implementation lead, Craig, who's on the call. So I don't think we had thought about contacting any of the implementation leads up until we started doing the projects. You know, so for us, that was like really useful to make that connection with somebody. It just sort of like brought all the guidelines sort of like to in sort of reality, really, you know, so it's been really useful to have that contact with Craig. But now that we've sort of like having our frontline staff and my carers looking at guidance to see what's relevant and how we sort of like meet the guidance that you produce, we really sort of like really like the quick guides, the easy read guides, because they're quite simple and stuff. Is there any sort of more of those guides coming? Because I know there's only a handful of them, you know.
That's a great question, Julie, and I think that's really helpful to hear the feedback about the quick guides. I think we hear that regularly, that the sector have found the quick guides really accessible and really useful in a number of ways. And I think that feedback is something that we'll take back to the organisation now that we've been going through the transformation, now that we've been going through the consultation process and looking at prioritisation and what products to look at, and also we've been looking at the strategic principles for social care. You can see all the details for those on the website, but I'll certainly take that feedback back around the quick guides being really well received and that being something that the sector would like to see more of, because certainly I've heard that in a lot of places.
Thank you. I mean, Carol, do you want to come in and just say what you put into the chat or anything further, and then I'll go to Heighton for his point. So Carol first, I think it follows on.
I think there has been a couple of questions around how you find out what's relevant for social care, and sometimes it is time consuming. And I know I've just done an exercise around drugs and alcohol recently, and we looked at 4 separate guidelines that were quite health related, and I ended up spending quite a lot of time teasing out those that were relevant for social care, creating my own little baseline assessment tool, kind of adding them all together, some of which were duplication. So sometimes that can be a bit of time consuming. So I don't know if that was helpful feedback in terms of just how we, if we're going to make it useful and meaningful, that's taken some time, and somehow if we can just take out those that are relevant for social care somehow would be really helpful.
That is really useful to hear, Carol, and particularly if you've been doing that and you've kind of created your own version, it would be really useful to see that, I guess, of an example of what we might need to try and do, because, you know, that's a live example. If you've taken there are things there that you need and you've needed to collect them yourself, but there may be something that we can do to support that. implementation wise. Do you have anything on that, Joe?
Nothing further to add, but it's so valuable, isn't it, to take these things back to NICE to see what we can do moving forward.
That's great. That's really great. Highton, do you want to come in and make your comment about the HDRCs? And then we'll go to the next session.
Right, sorry, yes, that was just for information really. It's that 30 local authorities have been funded by NIHR to develop the health determinants research infrastructure collaboration, and some of us are looking at social care evidence and research as well as wider determinants of health and public health. The other thing I was going to put in the chat was that I quite liked the theory of change model that Annette had shown, and it applies to the implementation of public health guidelines. And I was just going to say, is there a generic model for theory of change around implementation of NICE guidelines, like that we can apply to other sets of guidelines? I think that would be interesting to look at, because we are thinking about this in relation to evidence-based practice more widely, obviously in a local authority context.
Another piece of work to do. Okay. All right, so that's really helpful, and I think so. It's good to hear about the health determinants collaborations, because although that, as you say, they were sort of public health focused or health focused, I think the more they reach out into social care, the better that would be. That would be enormously helpful, I think, because that'd be another way of supporting the sector, and particularly, and building those links. I'm sure you've got very good links in Lambeth, but building those links locally as well as regionally and nationally. So that sounds really good. Okay. All right. I think what we'll do now is go to Ian. That's okay. Ian McBeath is going to give us a perspective from ADAS. So Ian, over to you.
Thanks very much, Martin. Hi everyone, I'm Ian McBeath. I'm director here in Bradford, and I'm also a trustee of ADAS, have been for 5 or 6 years now. And so I thought I'd just talk about the relevance of NICE guidance in social care, and echoing a comment that a colleague from Northumberland made earlier on. Given our funding constraints at the moment, we need to be more evidence-based. We don't have the time and resources to trial things now. We need to learn from what other people have done, learn from that NICE guidance and implement successful interventions for people straight away. But my overall experience is we've still got a way to go to embed the use of research in adult social care in the UK, and there are several reasons why. And I was thinking, every time I read a research project, bearing in mind I'm allegedly in charge here in Bradford, I think, why didn't I know all of this already? And do all of my other colleagues know it? And so I just thought I'd do a list of all the reasons why I think we don't necessarily use research in the way we should, and then come on to the reasons why I think we must, and we need to turn that on its head. So here's my list for 10, and there are about 10 things on the list. One's about funding constraints. So we know we've got limited resources, projects cost money, tight budgets, and so we often allocate resources to primary delivery rather than research. But again, as my Northumberland colleague argued, we've got to turn that on its head and be investing up front in knowing what works and investing in those services to make sure that we're delivering the right things rather than the wrong things. Workforce capacity is often an issue for us as well. So social care staff are frequently under significant pressure with high caseloads. That leaves little time for engaging with or conducting research. Again, we need to get ahead of that curve and sort of invest to save, I would argue. Training and education of staff is often another problem. Staff might not always have the necessary training to apply research findings. Social workers have got research training as part of their qualifications, but not that wider workforce. So we've got a bridge to get over there. But again, my experience is whenever you do engage, particularly frontline staff in research, and say this is what works, they're very enthused by it and really want to take that forward. We've mentioned on the call already about accessibility of research and findings not always being accessible to practitioners, both in terms of the language and the complexity and the length of documents. And so it's nice to hear NICE taking that feedback on the chin and coming up with other solutions for us. And evidence-based practice is another reason. While the importance is recognised, there's a gap between research and practice, and sometimes that is a significant gap, and it's about what are the mechanisms to translate the research into practical guidelines that can be practically implemented by our people on the ground. Other ones I've mentioned, I'm coming to the back of the list, you'll be pleased to hear. One's about policy and decision making. So research can be underutilised in policy and decision making. Some of that's because we're obviously political organisations and our politicians want a view about the kind of ways that we work. There's a little bit of ideology sometimes around adult social care as well. I think moreover, there's a preference for quick solutions. And so we often don't take the time to research the research and pick up on the best of that because it's time consuming. But again, I'd argue that that's a false economy. I think there are some issues around collaboration as well. The most effective research that I've seen in adult social care often requires this collaboration between academia, the service providers, the service users, the social care professionals, and building those partnerships can be challenging and time consuming. But again, I think you get better results if you put that investment in up front. Latterly, we've come up with quite a few sort of ethical and privacy concerns around some of the research, particularly around new technology. And some of it's about privacy and consent. Some of it's about mental capacity and people's ability to participate in research. And that can sort of limit the scope and nature of some research projects. So again, those things aren't insurmountable, but can become a bit of a barrier that we don't get over and therefore don't get the best from the research that we do participate in. And the final thing I was going to mention, which again, people are making inroads into now, is that famous crystal ball where you say, well, if only we did it this way, then it would save this money or it would generate these outcomes for people. And we don't all have crystal balls. And so we've got to come up with ways to measure and have robust mechanisms to evaluate how research findings do influence service delivery, and therefore we can motivate and build that case with our staff and our teams to improve things for the people we're trying to serve. So to get onto the positive side of things, that's a long list of reasons why I think we don't do it. It's changing. So on the positive side, I think to improve the use of research, we need to address all those challenges by investing more in research in adult social care. So that's a big thank you to NIHR. The HDRCs were mentioned as well. That's another route where we've got proper research in adult social care for the first time in years. So that's great. We need to enhance the research capacity of our workforce itself in our teams. And I think our commissioners in adult social care, every council's got a team of commissioners that buy commission contracts and test out the latest ways of working. So we need to influence them. And I think our principal social workers are really key as well. They're writing our policies, they're leading our practice tools. So we need to engage those two groups as an absolute minimum. And then improve how we access the research that's already out there. How do we collaborate better? And there have been some great ideas on the call already about fostering that closer collaboration between researchers, practitioners and policymakers. I know in my own council, we found the recent, well, it's not some of it's not recent, the nice guidance around assisting family carers, what's most effective for people with dementia, end-of-life care, autism. They're all pieces of work that we've used just in the last 6 months here in Bradford, and it's given us a real boost in terms of our policy direction and commissioning new services. It's become part of our development of those ways of working. And the final thing I'd say is that there is this new incentive on the horizon, and I think Christina mentioned it earlier on. Councils are now being inspected again by the Care Quality Commission. We haven't been inspected for about the last 15 years, but inspectors are back. Over the next 2 years, all 153 councils will be inspected, and the inspection assurance framework from CQC cites the NICE guidance as good practice, and the inspectors expect to find staff and policymakers and partners talking about whether they use that NICE guidance and what impact it's had on our policies and our outcomes for people. So there's a real inroad there. So I suppose I'll finish by saying, from an ADAS point of view, we have got a comprehensive infrastructure built up in England. We've got 9 regions, we've got policy networks, we've got commissioning networks and principal social worker networks, and it feels like time to get a little bit closer to make sure we're tying those things up. And when new things come out, and we're reminding people constantly that this great resource is there, and make sure your staff are using it. Thank you.
Leanne, thank you so much. I was scribbling down your reasons for research not being implemented. I'm going to use those again, but I will check with you first if that's okay. But that was great. It was a really helpful summary, I think, of lots of things. No, fantastic listing of things that people experience in this context. We've got time for any quick question, 1 or 2 questions if people have things they want to ask Ian from a very helpful local authority and ADAS perspective.
It was more a comment, Martin, if I can jump in.
And then Richard.
Just really to say, from the work that we've done historically with the CQC, and what I found working with the system is they very much looked at the quality standards from NICE as well. There are 4 or 5 statements that have been taken out of the guideline and prioritised because we know they're the biggest gaps nationally, but they are that quality improvement tool, so that you can use those to demonstrate your ongoing quality improvement. So they're 4 or 5 statements, so they're quite bite-sized. They come with suggested measures as well that you can do, and the CQC will often look to those specifically in terms of demonstration, in terms of quality improvement and that ongoing, it's very much now, isn't it, about that ongoing assurance with things. Lovely. Thank you.
Thanks, Joe. Richard.
Thank you. Let's see if this works. So thank you, Ian. There's a director who can manage his software and get online anyway. So I just wondered whether what we're hearing in the news is actually quite a lot of fear coming in around new technologies and AI, and it would be really helpful to have some join up around that, I think, and some exploration around what are we actually frightened of. Because it's in everything we've got at the moment anyway. This is called other things, both from a cybersecurity point of view. So we've got some baselines about what to expect from the market when we're thinking of commissioning things, and to advise the public around their data safety, and then the consent issue around joining into some of these research kind of ideas. That would be really helpful. I agree with mapping everything across to the CQC. They've only taken that from what they've seen as good practice anyway around social care. So it would make sense to link that to what NICE are thinking of doing in the future. Whilst allowing what occurs to me is that there needs to be some separation perhaps, or mapping around the wider adult social care world in terms of care homes, home care delivery, carers working on their own with their loved ones on occasion, and what's appropriate for local authorities in their context in terms of practice. So making those two kind of maps would be really useful, and happy to join in with any of that as well. So that'd be good. That's it from me.
Thank you, Richard. That was great. And just to say, I mean, so in the research funding world, so one part of NIHR, there's a new research program for social care, which I'm actually director of, but it's only been going less than a year, but it's going to have a call out soon for research proposals in digital technology and social care, picking up on some of those things that Richard was sort of highlighting. So those of you that are in the research doing world, or indeed in the research collaborating world, potentially that opportunity will come out not in the next couple of months anyway, should be out. So that would be a possibility there. Okay, I think what we'll do, I'm going to go to Margaret Ogden, who's been contributing voraciously to the chat. Thank you very much. Margaret, do you want to say something from the involvement group perspective?
Yes, thank you. With such great presentations before, it's a tough act to follow, I've got to say. But I will thank the team from the outset. Annette and Sarah and Martin and the rest of the team have been so great to work with on this project. It's a case that you don't want it to end, but of course it does have to end. I've been getting some feedback from the PPI group, and the group agrees that guidance implementation is important to service users and carers. They are the key partners in supporting the implementation of guidance, and it's important that they should be involved at every stage of implementation. Saying that nice guidance and good practice was being followed would be very reassuring for service users. And they value being involved in decisions and understanding the reasons for why decisions are made, which can help to improve relationships between service users and carers and staff. The group have been happy with the PPI from the direct research team to date. There is, however, concern around lack of input from service users and carers in implementation sites, and we feel PPIE needs to be embedded in NICE guidance implementation projects moving forward. At a national and local level, the group agreed that service users and carers have a fundamental role in supporting implementation. And we say that NICE are good at drawing PPI into guidance development. However, the PPIE needs to go further than that and be a core component in the implementation of NICE guidance. The group note the different structures within local authorities are likely to add to implementation challenges, and the group is concerned that findings of this study may not be picked up in the current climate of budget cuts. The group thought the findings of the study are important because they highlight the substantial efforts that are required to do implementation well. This also increases the risk that in practice, NICE guidance implementation may not happen in many local authorities. The group feel ongoing PPIE involvement is crucial, and we would like to be involved in further research on implementing guidance and evidence-based practice in social care to support greater guidance uptake. And now we have integrated care boards. It is up to them to ensure that all partners are working in the same direction. I just want to thank the PPI group because they've been really great, and they've gone the extra yard, even dropping everything they were doing to help me come up with this little presentation today. So thank you, everybody.
Thank you very much, Margaret, and the rest of the group. So thanks enormously for that. That's great. Right. So just a couple of things. I'm just going to say one thing, and then Richard, I'll come back to you in a moment in case you want to add anything further. So firstly, Annabelle Fenton, who's the Senior Comms Lead for Care Policy Evaluation Centre, has put into the chat, if you'd like to be updated with more findings and events related to the project for this study, you can fill out, put your email into the link that she's just click on that link and add your email. And if you can't get the link to work, or you don't do it now, you're very happy to contact us, and we're very pleased to send you more material if that's helpful. So I'm going to hand over to Richard. Do you want to? I'm going to let you have the last word, Richard, because you had the most difficulty in joining us. So over to you.
Thank you very much, Martin. I'm happy to join any meeting you're holding and cover for you for half of it badly as well, if that ever happens. One of the other things that occurred to me, and I've just put it in the chat, so something around, we were looking at kind of our offer and our front door over the last year or so, partly because we've got increasing numbers of people coming to us saying we need help. A lot of that's driven by other issues for them. in a societal context of increasing kind of financial insecurity, etc., rather than a need for social care in the traditional sense. But the only research I can find on this was completed some years ago by John Bolton, although very valid in its kind of context around hospital discharge and how we might offer something that's important for the person's outcomes. I can't see anything else. And this is fundamental to kind of how we start with people, which is what colleagues were referring to earlier. So something on that would be really fantastic, I think. And the other thing which is dear to my heart is the voice of the person, and some evaluation around the different ways we can gather that and how valid that is in terms of trying to pitch that back to our population about we've listened to this, we've heard that, we're now doing something else. Because at the moment we're very clunky in how we do this. So we're doing something locally around exploring that social care as user survey that goes out every year that I think misses huge tranches of our population, but that's going to take some time. So any kind of thoughts that colleagues on the call or in NICE have around that would be really great, I think. So that was 2 asks, I'm afraid. But yeah, hopefully it lines us up for our next discussion, doesn't it?
Okay, thanks enormously, Richard, and thanks for persevering with the tech. So that's great. So, okay, I think I'm going to draw things to a close now. So thanks everybody for coming along today. Thanks. So we've got a bit from the chat from Judith. Thanks, Judith. So please, I think colleagues from NICE who contributed so importantly to the project throughout, and you can see there the contributions today as well. Very keen to hear from people. I think we've had a very interesting dialogue today, or whatever it is, multi-log or something, but very interesting discussion today. And I just think there's, I was trying to think there's a virtuous circle, but the links between inspection and research and practice and guideline development and so on, that these are all interconnected. We can all pull together, as this project was trying to do and as the webinar has been doing. That's surely going to help things as well. So I'm just going to say thank you. A huge thanks to Annette, who led this project from the beginning. It's not been a conventional project. It's been hard to do. So Annette, very well done in getting this project and seeing this project through to this point. Just to say that Annette used some of the learning from the project to get her recently awarded PhD. So we can also thank her and congratulations on that as well. So there we go. Annette, you can have the final word if you want to say. So over to you.
Oh, thanks, Martin. No, thanks to you as well and to Richard. And yeah, sorry it didn't work with the technology. And thanks to everyone who really participated in the study. And I hope it's more like a see you soon rather than goodbye, but it has been just really amazing. And I feel there's a lot of very good energy going, so hopefully we can build on it and yeah, work together again soon. Thanks everyone.
Thank you and goodbye.